Now we're going to discuss the obstructive uropathies. Many of them are congenital, and obstructive uropathy can occur at any level and still result in obstruction. And the common presentation of an obstructive uropathy is hydronephrosis. So obstruction at any level will cause basically urine cannot go out normally, and so the kidney then becomes dilated, and you can have severe kidney damage. It can present with abdominal or flank pain, sometimes with pyelonephritis. It can be picked up on follow-up of urinary tract infections. That's when you can start sometimes seeing obstructive uropathies. They can have a weak or decreased urinary stream because of the obstruction. In the newborn with an obstructive uropathy, particularly posterior urethral valves, you can certainly palpate an abdominal mass. Then you start thinking, is this hydronephrosis? Is this a polycystic kidney disease? And certainly your workup will let you know what it is. Any newborn male that has a palpable bladder, a weak stream, you should think of an enlarged bladder, secondary probably to posterior urethral valves. Sometimes in infants they may present with sepsis or urosepsis, and then the workup reveals the obstructive uropathy. Therefore, all these patients need avoiding cystourethrogram and then further study with renal scanning. This will tell you about uptake into the kidneys and then the outflow. And certainly also worry about stones, not that common in children. CT scan would be indicated. Other causes of obstructive uropathy, the most common is the ureteropelvic junction obstruction, and this can lead to hydronephrosis. Ectopic ureters can also cause obstruction. Usually with ectopic ureters, you don't have the same sphincter effect, and so with ectopic ureters you can have urinary incontinence and also urinary tract infections. When we discussed primary enuresis, we talked about primary nocturnal enuresis, but we also mentioned some anatomic problems, and with an ectopic ureter that can certainly happen and be a cause of primary enuresis. Ureterocele is a cystic dilatation. You're going to see that in girls that have a ureteral duplication. Posterior urethral valves are most commonly going to be seen in boys. It causes reflux, and actually it can reflux all the way up the kidneys and cause end-stage renal disease. They can cause hydronephrosis. Again, remember, a newborn male with a weak urinary stream and a palpable abdominal mass, right away think of obstruction. It's just a dilated bladder, and they can't get the urine out because of the posterior urethral valves. And the diagnosis is made on avoiding cysto and will require surgical intervention.